In 2013, the American College of Cardiology and American Heart Association issued statin guidelines which relied heavily on cardiovascular risk. This led to a lot of controversy, people arguing that maybe too many are recommended statins, maybe some do not need to take the medications, and maybe others, younger people, should be recommended in higher percentages. Now, with the US Preventive Task Force guideline, the question is to what extent the new recommendation addresses some of the controversy from 2013.
We compared the 2013 guidelines from the American College of Cardiology and American Heart Association to the newer 2016 guidelines from the USPSTF. And what we found was that in comparison to the 2013 guidelines, the newer guidelines would recommend 9 million Americans fewer to be on statin therapy. Now, some of those individuals were older and didn't have any other risk factors for heart disease, so it probably made sense that they were no longer recommended for statin therapy. But over half of the 9 million individuals were actually younger folks between the ages of 40 and 59 who had a high long-term risk of heart disease if we looked out over 30 years. And in addition, about a quarter of the individuals who were no longer recommended for statin therapy had diabetes, who were considered to be high risk as well.
I think we're still searching for the perfect guideline, and I think more research needs to be done to better determine who should receive statins. One promising concept that we're working on relates to quantifying benefit of statin therapy. Who will benefit the most from receiving these drugs?
Having multiple guidelines can actually be confusing at times for physicians when they're trying to determine who should and shouldn't be on statin therapy. I think the important thing is when you have multiple sets of guidelines to understand what the pros and the cons are of each. And that's what we tried to do in this study. And when you understand what the pros and the cons are for each set of guidelines, you can better have a conversation with your patients about whether each individual should be on statin therapy or not. And that's actually a really important point in both sets of guidelines. They both strongly advocate for an informed conversation between healthcare providers and patients.